Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
I was really concerned about gum disease because I have spoken to a few people and they were complaining that their gums were bleeding. And we were so fortunate to have Dr. Estelle Beresford, who just wrote an article in our July issue, How to Avoid Periodontal Disease. And it's a long word, but it's really important. So, Dr. Beresford, thank you very much for, being here with us today and for talking about what we call gum disease. People don't know the word periodontal.
Right. Hi, Anita. Thanks for having me today. All right, gum disease is the layman's term for periodontal disease. Periodontal disease are any of the diseases of the structures that support the teeth in the jaw. So that includes bone, gums, and the tissues that attach the gums to the teeth.
And so if someone's having gum disease, they probably should, do they know it or is it painful, or how do they go to the dentist for it?
People know they have periodontal disease when they start to have bleeding, swollen gums, and the downside of periodontal disease is it's not painful. So because it's not painful, people often don't seek help until it's gone very far. What happens is probably 5 years into having gum disease, let's say you haven't been to a dentist in your life, and the gums puff up and you get swelling and pain.
What do you mean you haven't been
to a dentist?
There
are people who don't go.
Ever been to a dentist?
Yes, I've had it, and especially, there are people who come from countries where there's no dental care, there's no access to care. Then they come to the States and they have access to care. And they come in, I've never been to a dentist. I don't have any problems. I have one loose tooth, though. And that's how they find out they have gum disease. Those are extreme cases. That's, not the usual. Usually I see somebody with some bleeding gums and they just need a good cleaning. And
good
that'll
cleaning
clear it
can
up.
help in the gums.
Right, if you catch it early enough.
Okay.
So that's why we always say come in every 6 months to see the dentist so that you can check and make sure you don't have this disease. It is not painful when it's early, but it's easy to treat when you catch it early.
Oh, good. Well, most things are easy to treat when you catch it early, isn't it? But gum disease. Okay, I want you to know that someone's watching. Vicky Rodas Tuniscliffe is watching, and we'll just keep going. It's funny, people keep jumping on, and they learn so much. So I want to pursue that. So now, let's say you're just doing a general cleaning. How do you know that someone has the gum disease and that it's not something you can just casually take care of? That it's really serious.
We actually do measurements. So regularly measurements are done of the gum. From the height of the gum to the bone should be 3 millimeters in a healthy person. So if it's more than 3 millimeters, that's someplace the toothbrush can't clean. And that means there's swelling there, probably swelling or loss of bone. And either of those constitutes periodontal disease. And also along with your radiographic, which are your x-rays, can show you if you have lost bone.
Okay, and then what were you going to do about that?
It depends on how far gone it is. Now, if it's just a little bleeding puffiness that the person never noticed, deep cleaning. So you've probably heard your friends say, there are people out there listening, you've heard your friends say deep cleaning. That's technically scaling and root planing, and that's numbing the gums so that you can get in there and clean the stuff out that they weren't able to get with the toothbrush because it's too deep for the toothbrush to reach.
I see. Well, the nice thing about this is that it's not real serious at the beginning. You wait too long,
then it becomes serious.
Because I remember years ago, I had to go to a periodontist, and I had very serious. It was very painful because I had apparently it was hereditary. My mother had it. Her mother had it, and I just wasn't doing a good enough job. So after that happened, and I wasn't flossing either.
Oh, that's important.
So once I got, finished with what they had to do, I'm like an angel about cleaning my teeth, about flossing, about using a water flosser.
Waterpik or water flosser,
yes.
Right? Okay, like what you have was a genetic form, and those are more aggressive. So people will lose chunks of bone, like they'll get the puffy gums, and they're, what's going on here? And before they know it, they're losing chunks of bone in certain areas rapidly. And those are like they're called your rapidly progressing periodontal diseases. So you have juvenile periodontitis and just the adult rapidly progressing periodontal disease. These are big words, big mouthfuls, but it just means it's hereditary. And when you start to develop symptoms, it's very hard to control. So even just flossing and brushing for someone who has a hereditary problem is not enough. They need to make sure they're seeing their dentist more often because their body is always going to have the propensity towards getting gum disease and losing bone in reaction to an irritant that maybe the rest of us, we might just swell up a little bit.
Well, are there foods that people shouldn't eat that get caught into their gums? I know it's a funny question, but
there are, but that's different than periodontal disease. So notorious foods for injuring gums and causing like an acute gum irritation, crab, which I love crab. I'm not telling you not to eat crab, but the fine shell on crab gets caught between the teeth. And I've had people come in and they have no idea my gum is swollen, and they've been such great patients and they floss and they brush. I don't know what's going on. I think I have gum disease like my sister. And I look and I say, well, did you eat potato chips? Did you eat popcorn recently?
Oh, popcorn.
Or crab that gets in between the gum and the tooth and people can't get it out. And then they get a local irritation, and usually just scale it and rinse it out, in the office, and we can remove that for them.
So that's a good point. And and there's hard candy. There's all sorts of things that do get stuck. Corn,
right.
And you said popcorn, but
yeah.
But even eating corn, isn't it that also
not usually because it's actually the hard skin on the popcorn, because it's dried, that gets stuck in between people's teeth and they can't remove it, and between actually the gum and the tooth.
So so people have to watch out. Seth Levy is now watching.
Hi.
Hi. You have such beautiful teeth when you smile.
You.
Oh, my goodness.
Thank you.
Have you always had beautiful teeth like that? Was that when you were born this way?
Actually, it's care. We were lucky enough to get regular dental care. My mother had insurance, and in those days, that was unusual. I say those days, it's not that long ago.
No, but you're right.
She had insurance, and we went to the dentist every 6 months. We had cleanings, and the dentist would, drill into us. Oh, you got to floss, you have to brush, and it's always, teeth are always a work in progress. And I tell patients, you're always taking care of them. Just like you take a bath every day, you floss every day. It just is what it is if you want to take care of them.
And so, you really you've experienced this yourself, and that's why you can tell people what they should be doing.
Some of it, yeah.
Well, let's go back to the gum disease. When in your article, it was really very clear, and you're really quite an expert, because if you don't take care of it, you really could lose your teeth, couldn't you? And
yes,
and then the pain. That's, you see, most dentists that I've ever gone to, I don't have pain. People should not, and especially for you. You are a painless dentist, and I know I've heard people say that. So it's a matter, though, of how long you've let your teeth go, right?
Right. It's if you're not cleaning spots, you don't know, because the beginning of this disease is not painful. There are some spots you just can't reach with a toothbrush. Behind your very back molars, it's hard to get a toothbrush back there, and those are the spots we clean every 6 months. So if you can't get back there, I go and I clean the bacteria out. If that's left there year after year, the body reacts by inflammation. That inflammation makes the bone reduce, and that leads to loose teeth. So when people are like, I don't have pain, I have no problems, I don't go to the dentist because I don't have problems, you don't know you don't have problems. So if nobody's checking, you think you have no problems. But if I go in and I find pockets, they're not necessary, which is the spaces around the gum that form when you have the infections, when you have bacteria around your teeth. If I find those pockets and they're not cleaned out, you will lose bone, you will lose teeth over time. And it's usually painless. When it gets very advanced, it becomes painful.
Can you tell if you have gum disease by bad breath?
That's one of the signs of gum disease. So if you have bad breath, one of the places you want to start is the dentist, because maybe you just need a good cleaning.
I saw a funny commercial. There was a woman, I don't know if you saw, a woman was complaining that all her friends seemed to have bad breath, and when it really came down to it, she had bad breath and she was smelling her breath.
Oh, wow.
But what happens, you live with it, you don't realize it.
Right.
And it's very hard to tell somebody, oh, you have bad breath, right? You're not going to say that.
Well, it's better to hear it in the privacy of an office where somebody's telling you how to fix the problem. Yeah. Absolutely.
Yeah, as a dentist. So, are women better about going to the dentist than men, or is it not one of those things?
I think women are better at going to the dentist than men. Also, they're more likely to bring the whole family to the dentist. So I'll find if the woman comes to the office, she's going to bring her kids, she's going to bring her husband, she's going to bring her mom. And, so they'll motivate everybody to come in and take care of themselves.
Yeah, right. That's very true. Because usually the women, I don't know why this happens, but women usually are telling their husband, you need, whether it's a dentist or somewhere else, why don't you go to the doctor? No, I don't have to go to the doctor, but it's so we want to make sure that when people come to see you, and that's what I want to do. I want to give your information out so that everybody will make that phone call, and it's 561-642-8501.
Right.
I'll do that again. It's 561-642-8501. 8501, and Dr. Beresford is located in West Palm Beach, and I would just tell you that the name of her practice is West Palm Beach FamilyDentist.com. So you see, you have that family dentist in there, so you want people to bring their family.
Yes.
You don't do dogs, though, do you?
No.
Because it's a big thing now. It's funny. I think that some people probably take their dogs to the vet to get their teeth cleaned more than themselves.
Sure. Those are their children.
Right.
So yes. I mean, I've had people tell me, I'm going to have to wait because my dog has to have his cleaning this month. So I'm going to come in next month. I've had people say that to me.
Have you really?
Yes.
No, that's funny.
So dogs' dental health is important too.
So the one thing that I do know that many times when dogs have anesthesia to have their teeth cleaned, because you can't, I guess, they're not going to, they'll bite you before you do, get into their mouth or something. I don't know why they have to have anesthesia.
That's why. They'll
because
bite you.
They would hurt you.
Yes.
Right. Your patients don't bite you, do they?
No, but they can have anesthesia to get their cleanings done. So we numb, or you can get a little sedation so that it's more comfortable and you don't have to be awake through it. You can just kind of be relaxed. You just need somebody to drive you in. You can get your cleaning done and a lot less traumatic.
Yeah, but traumatic. Well, but if they go on a regular basis every 6 months, it's probably you're going to take care of it, and it won't be anything major that they have to do.
Right.
It's maybe that first time when you said, when did you have your cleaning last? And they said, well, I don't know. I didn't have any cleaning or something, right? And everyone has to have cleaning. And as you said, every 6 months, put it on your calendar. That's what you send people home with, right?
Right.
Now, how about the flossing? So if people floss and they use then even what else? Well, first of all, let's talk about electric toothbrushes. That's what I'm sure you prefer. Do you not prefer electric toothbrushes rather than regular?
People do a better job with them. It does. They do a better job with the electric toothbrushes. Studies show that you can do just as good a job with a regular toothbrush, but it takes more time. It's just getting the toothbrush to every area. And most people, the electric toothbrush adds to their dexterity. So you don't have to get into a little tight spot and do circular brushing. The toothbrush is doing it for you. So my patients do a better job when they use that. And like I said to you before, spending $80 on a toothbrush helps you want to use it. So, hey, if that's what it takes for you to take care of your teeth, then great.
Right. And then I just recently bought a Waterpik. Because a Waterpik seems to, when I think I've cleaned my teeth, and then all of a sudden I use a Waterpik, something comes out of my teeth, some green stuff from my salad or something.
Yeah, and they feel amazing too. So, I think of it as an adjunct to brushing and flossing. So if you're having some trouble, maybe if you had a Waterpik, you can get into those tight areas and flush things out that you couldn't get with the floss or the toothbrush. Flossing and brushing are the best ways to keep the teeth clean, but not everybody can do that. You get a flosser, and most people do a good job, the water flosser.
I don't know if I said this to you before I asked you, but you're just a beautiful woman. You wonder, why did you go? Why did you become a dentist? I mean, you could become a lawyer. You could have been so many other things. Where did that all come from?
Actually, I thought I was thinking about being a clinical psychologist when I was in high school. I was interested in science and medicine, and I thought, you know what? yeah, that sounds like me. Started taking psychology and I didn't like it. I didn't like psychology. And a friend's father, he was a physician at a local hospital, and he said, you know what? You guys should think about dentistry because you like working with your hands. We were in art class together. He said, you like working with your hands, so why don't you think about being dentist? You can pick your hours, and he bought me with the pick your hours. I said, oh, really?
Oh,
I don't have to be on call? I'm going to check that out. So I went and looked into dentistry, and I loved it. I went and volunteered at a dental clinic, and from then I've been in dentistry. I've been working in dentistry now 22 years. So
that's funny you should mention about the dexterity of your hands, because I have a cousin. He is no longer living. He's much older, of course, but than you. But he wanted to be a dentist, and he talked about they didn't think that he could be one. I mean, they went to dental school, but because he didn't have the dexterity of his hands.
Yeah, that's
but
important.
somehow I don't know what he did. He went to physical therapy, did something so that they would then accept him, which I thought was really funny. So it's really necessary, isn't it?
Yeah, that's really necessary.
I mean, they get you in. You have to get into a lot of positions, I'm sure. To it's not just because you're not doing the cleaning. You have, of course, your
hygienist.
Yeah, hygienist. Yes. But when you have to get in the back of someone's mouth and try to put in, fillings and other kinds of.
People don't realize it's a very physical job. It really is. Most of the time, people just see you sitting in the chair working on them, but I'm moving from room to room. I'm bent over looking at the patient, and it's a very physical job.
And you're standing up.
Yeah, and I don't like to keep still anyway, so it kind of, I'm not the kind of person who sits still. I like the moving back and forth, and so it's good for me.
So are you saying that if you're working on one person, then while something's happening, then you move to another patient?
When it's time for a break, because people don't like to be open for long periods. So, okay, we're going to take a break, and we take a break. And
that's right.
But
Your mouth
usually
is
I
open.
just have one person in the chair with me.
Right. But you do think, I just thought about what you said.
Yeah.
If they're having a long procedure, they
stop
can't
and take
sit
a break.
there and just keep their mouth open.
Right.
I guess they could, but
yeah. People don't really realize that. It's like a ballet. Okay, time to take a break. And they take a break, and then I might go do something else while they get a little 5-minute break and come back. And
that's good, the ballet. So you're the ballet dentist. I have to remember that, right? Yeah, well, that does make sense.
Yeah.
So if you were talking now to an older adult, what are you going to tell them that they should be doing with their teeth? Because some of them have dentures. Some have, and I know you also will do implants.
Yes.
So you do a lot of things, but you have an older adult who's had false teeth. Now, what could happen to their gums?
Well, as we get older, the gums don't stay the same. The actual gum reduces in size, and the jaw drops back, and there's less for a denture to hold on to. So let's say you got a denture at age 50, and the denture was fitting fine. You'll find after 5 to 7 years, the denture is moving around, clicking, pinching, and that's your body changing. The cells are always remodeling, changing, making new cells, dying off, and the jaw without teeth tends to lose bone. So it's time to get a new denture after 5 to 7 years for the average person. Some people can keep them longer, but the average person, 7 years is time for a new one. Most people don't like that clicking. Most people, as you get older and you have less jaw, a denture is not going to fit as well. So the next option is implants, and they hold in. They're just like your own teeth. They're
so
more.
You're going to have an implant with your dentures,
or to replace the teeth that are missing that your denture replaces. You can do multiple implants, so you have a full smile again, without having to take dentures in and out every day or with each meal, without having to take them out and clean them. Because people think because people don't complain about them that they're okay, but most of the time people are just tolerating their dentures because they don't know that there's something better out there. And there is.
That's a good point. And once people stop eating, right, now their nutrition, everything goes down,
That's right. That's right.
They want to eat mushy food.
And that's a big sign of having dentures, that they realize they're not able to eat a full diet anymore. So people they can't eat the greens, they can't eat their vegetables because the dentures don't mash vegetables as well. You can always cut up meat or blend up meat, but the vegetables are hard. It's very difficult for them to consume vegetables with a full plate.
Well, I was once, at a restaurant, and a poor person was so embarrassed her dentures came out.
Mm-hmm.
And was that because they're not fitting properly? And is that common?
It could be that maybe they didn't fit properly to begin with, but like I said before, as you age, or even if you lose weight, the denture can become loose, and you may need relining or remaking of the denture so that they can be comfortable. Also, if they're falling out, just implants to snap dentures in is an option. So someone who's used to their dentures and now, oh my gosh, I find my dentures are getting loose and clicking, they can think about getting implants that will help the denture hold in. They're almost just like the snaps on a shirt where it snaps in and the denture won't fall out while they're functioning.
And so do they keep the dentures in all the time after that?
No, they take them out and they
like
clean
they always
them.
do. What
but during
to
the day, the implants, they're just rounded caps. So they're not uncomfortable. They're not pointy. The implants are just in the mouth, just like a rounded snap. So it's comfortable.
And it will hold the denture in.
Mm-hmm.
What do you call that?
Implant retained denture.
Are you doing a lot of those?
Occasionally, yeah. I am seeing more and more patients who want them, so yeah.
And I would think that would be a great solution for people, because I think that's the worst thing. If you go to nursing homes, and you see so many older adults there, and many of them, today they didn't have the implants the way they do today.
Right.
And so they have them, and sometimes they lose them. They don't have them, and it's not a very pleasant thing.
No, it's not. Because, you still want to socialize, and it's one thing to say that you can eat, but to eat comfortably and feel comfortable while you're eating in front of people, nothing beats having your own teeth that hold in. And those dentures really get in the way of that.
So the goal is to avoid dentures, too. Let's talk about that.
If you can, the best way to avoid dentures is regular care, to find things early. So maybe instead of a root canal, you're getting a filling. Instead of having to take a tooth out because it's carious or has a cavity, you want to
do root
not
canal,
get it right. You want to try and hold on to your teeth. So if you're finding things small and early where you can save your teeth, do that. Nothing beats your own healthy tooth in your mouth.
Yeah, that's very, very good, important message. My
Prevention's
guest,
key. Yeah,
right, that's true. Prevention. My guest is Dr. Estelle Beresford, and I would just tell you that she's very soft-spoken, and this is just the way that she is. And I think that anyone who's looking for a good dentist, and doesn't even have to be in West Palm Beach, even though that's where she's located. Dentists and it's not like going grocery shopping. I always tell people, you want a close grocery store, right? But when you want someone you're comfortable with. Absolutely. Right. You want to be someone you're comfortable with, someone that's very good. So check around. And, we're very careful when we have people in our magazine. We try very hard to have really good, responsible, talented practitioners. And I know that you pride yourself on your dental practice.
Yes, Anita. Yes.
Yeah, it's because I know I've heard some people who've been to you and they've been very, very pleased. And how long have you been practicing?
I've had my own practice 15 years. So let's see, I graduated in 99, so it's been a long time. A lot of times people look at me and they think, oh, you look young, but I've been practicing now for 18 years.
Right. Yeah, you do look young, but you've just kept yourself in good shape, and so that's really good. But so everyone should come and see her teeth. That would be you're your own model, actually, for teeth.
That's regular care.
Right, regular care. Did your mother profess regular care? When you were little, did she stay on your case to brush your teeth?
Yes, because the same thing you were asking me, did my family have good teeth? And actually, my mother had a genetic periodontal disease. So she was very serious about taking care of your teeth. So very similar to what you're telling me just now, right?
Exactly.
So she's like, you have your teeth, take care of them. You have your teeth, take care of them. And that's what I try to do.
Yeah. And do you brush your teeth? And you probably brush them twice a day, in the morning, at night?
Sometimes 3.
You do sometimes 3 after you eat?
Yes.
But what should people do? They're working. Tell us what typically, if you do it in the morning and you brush your teeth at night, is that enough?
That, I'd prefer it if everybody brushed their teeth after every meal. And that's what I tell people, best after every meal, but twice a day is good. After you
every
eat,
meal.
yes. After you eat, if you can't get a hold of a toothbrush, at least rinse excess food and sugar off your teeth.
Oh, we haven't even started talking about sugar. Sugar's bad, huh?
For teeth, yes. Sugar feeds the bacteria that we've been talking about, and they produce more acid, and that's how we believe cavities start in the mouth. Also, when you eat sugar, you're feeding the bacteria that causes gum disease, and that makes them spread and grow more easily. If you're not cleaning it away within 24 hours, those bacteria are going to have bigger colonies and produce more acid and lead to cavities.
So we have now sweet and low and things like that. What is that sugar?
See, the sad part with the artificial sweeteners is some of them are still nutritive to bacteria. So the bacteria can still get some energy and produce acid from the artificial sweeteners, and you still want to brush. So let's say you drink that Coke Zero or Coke One or whatever they have now. It doesn't mean that it's preventing cavities. It's just lower calories.
Well, I guess we've done it. We're gonna say goodbye, but I don't want to do that without giving everybody your phone number. The phone number to call again is 561-642-8501.
Right.
And also, you can get on the web, West Palm Beach, familydentist.com. And I would suggest you go in for a consult, right? Go in, see you, have you check over their teeth, and I think you'll be very happy. And I thank you very much for coming.
Thanks, Anita.